UnitedHealth Group CEO Andrew Witty is testifying in public for the first time today after a crippling cyber attack hit the company in February. He's going to speak to lawmakers on Capitol Hill about his response to the hack and United's aggressive growth. CBS News Homeland Security and Justice reporter Nicole Sganga is with us now with more on this. So, this is a lot of people may not have known about the cyber attack or probably forgot about it by now. But what could we learn today from the company's CEO about the ransomware attack?
Yeah, just an absolutely massive ransomware attack, what lawmakers right now on Capitol Hill are calling the biggest cyber attack to ever hit the healthcare industry. And we were listening to the testimony by CEO Andrew Witty just moments ago, really revealing more of a timeline and how cyber criminals were able to gain access to the UnitedHealth platform. Change Healthcare, will remind our viewers, is an IT provider that lives under that parent company. And what we learned is that the breach first occurred on February 12th. That was several days, actually 2 weeks before United became aware of the incident and reported it. And they got through due to stolen credentials. They were able to remotely access the network. And there was no extra layer of security here, Anne Marie, no multi-factor authentication. Also a really key point that shows just how easy it was for this Russian-affiliated group to gain access here. We're also hearing the first public apology from Andrew Witty, the CEO, saying just moments ago he is deeply sorry. He's also going to dive into some of the emergency actions that are underway now.
Often companies do not like to talk about these cyber attacks, right? And we never really find out how it was resolved. Did they pay the ransom? How people were impacted? Do we know any of that at all? Whether or not the people who were able to get into the system were able to have like a meaningful impact?
Yeah, absolutely, Anne-Marie. I think let's address the questions in their order. Number one, we do know that UnitedHealth made the decision, Andrew Witty saying moments ago, he himself decided to pay that ransom. Now, we have not seen a number on how much that ransom was. There are some experts who have been tracking Block Exchange who have said somewhere in the 20 to 22 million range. In terms of what the actual impact was on hospitals, practices, pharmacies nationwide, it was really truly crippling when you think that Change Healthcare touches 1 in 3 U.S. patient records, that they're responsible for 15 billion, that's billion with a B, payment transactions annually. And just to give our viewers a sense, this is how many hospitals, many practices, many pharmacies actually submit and file insurance claims, how those are processed. And so hospitals we've spoken to, practices we talked to, were having issues with payroll. They weren't getting paid, right? Because they were having so many problems submitting those claims. Now, Change Healthcare and United has said that part of the reason why all of that sort of cascade impact happened is because they had to completely shut down the system when they first learned of this ransomware attack. Andrew Witty calling that just moments ago both extremely disruptive and the right thing to do. And I think many cyber experts would agree with that. But right now, one of the biggest concerns, patient data. Cyber criminals said they accessed 6 terabytes of data. That is massive. UnitedHealth not saying how many Americans, how many patients were impacted so far, but confirming that there was sensitive information, patient health information, that was compromised during this attack.
All right, Nicole, ought to be a very interesting hearing. Hopefully we'll also hear about what the company has done to make sure something like this does not happen ever again. Nicole Sganga, thank you.